Delighted to welcome to the Informer platform an emergency physician, a specialist in trauma. He's been working tirelessly behind the scenes over the past few months. His name is Dr. Stephen Parnis. Welcome, Stephen.
Thank you, George. Nice to be here.
Can I just ask you, you were there at the very beginning of this COVID pandemic in Victoria when the first cases came through. I think it must have been around Australia Day at the beginning of the year when we saw the first case. Is that right?
Well, I didn't see the first one, but certainly I did come across a number of cases at some of my suburban hospitals very early in the piece.
You were across three different emergency units at the time, were you not?
Yes, and I continue to do that for my sins. It's challenging, but it's just sort of worked out in terms of my career development that I work across three. So I'm part-time at all of them, and they are very different. One's right on the suburban fringe in Melbourne, and it has been the COVID capital of Australia for many months. I've also at two tertiary hospitals right in the centre of town, and they've seen COVID, but they've also got subspecialty care. So, you know, that's been interesting. It's enabled me to speak quite freely in the public domain because hospitals are quite anxious about doctors speaking publicly, and the fact that I work at a number of them and have my own profile has made it possible for me to do that. But yes, it's always a surprise when something that you see on the other side of the world hits you on your doorstep. Australia's been, I suppose, lucky in that the distance has protected us from a lot of infections. But this time, the word pandemic really applies. Pan meaning everywhere, of course. And way back in late March, I went to work one day and I and a number of other doctors got gently pulled aside and told by the director of that department that we had been close contacts the previous weekend of colleagues who were subsequently positive with COVID. And so we had to go into 2 weeks of isolation. And that was a very stressful thing because we didn't know whether we were going to develop the virus. You know, I'm 51, I've got a couple of health issues, and so I know that I'm at greater risk than a person in their 20s, and issues around the kids and what this meant for my work, for the community. So many questions. We've got fewer questions now, but it's still a very uncertain time for us all as we wonder what the months ahead hold.
Dr. Stephen Parnis, what have we learnt in the months that we've had to live with COVID in Australia?
We've learned a lot about COVID. The thing that we've learned is that it's highly infectious, that you can suffer anything from mild or not even recognised symptoms, or you can have that spectrum of severity of illness all the way through to it being absolutely life-threatening. We know that your risks are increased by generally being older, by having a number of other chronic illnesses, things like diabetes or heart and lung disease. But we know that those rules are not fixed. I have seen young people who are otherwise healthy who were put in intensive care as a result of getting COVID. We've also recognised how quickly this virus can spread. And we've also learnt that just as the virus can target the vulnerabilities of each person's health, it targets the vulnerabilities of the systems we have around the world. And by systems, I'm talking about healthcare systems, systems of government, systems of community cohesiveness, all of these things. So it's posed enormous challenges for everyone.
And we're hearing more and more that you get COVID and you don't even get the immunity. A great many people are saying that if there was any immunity, it's now dissipating really quickly, and the chances of a reinfection are very much on the cards.
Yes, the medical literature has confirmed a number of cases around the world now where people have had confirmed COVID more than one time. The first one we saw was someone who got the illness, I think it was in Europe, in March, and then they got it again in Southeast Asia about 5 months later. That's concerning. It's not unprecedented. I mean, viruses can change their spots, if you like. We call it antigenic drift. And it's a case of the immune system playing catch up. So what we all thought, me included, was that if we got the infection, we'd turn into some sort of superhero and we could walk in unaffected and unafraid and be able to do great things. Unfortunately, that doesn't appear to be the case, but that doesn't mean that our treatment and prevention options are greatly diminished. If anything, it makes me think that depending on the strategy, a good vaccination may be able to overcome that, or we may need things like annual vaccination. We just don't know yet. It still has so much to play out.
Dr. Parnis, the last time we had a pandemic in the world was nearly 100 years ago, and it was the Spanish flu. It came and it went. Is there any chance that COVID-19 has come and may also go the same way?
There's a good chance of that. How likely and how long it will take is anybody's guess. Sometimes a virus mutates into a form that is less harmful, and that's what we would all hope for. But we haven't got the luxury of waiting, potentially a couple of years to see if that happens. So in the meantime, the rate of work being done worldwide to try and develop a vaccine that is both safe and effective is unprecedented. People have to remember that in the usual course of events, a vaccine may take 5 to 10 years to develop. And we've gone in the space of less than 12 months to having at least a dozen reputable projects that are now at what we call phase 3 trials, where they are subjecting tens of thousands of people to it to see if it prevents the virus, causes a less serious disease, but also at the same time doesn't have nasty side effects.
All right, we have to live then. That's what you're saying effectively. We have to learn to live with COVID. Tell me about masks. There's been so much conjecture, so many different people, and there's been so much misinformation. What is your take on the wearing of masks? And of course in Victoria we're obliged to, and it's still mandatory. It's what the Premier has asked each and every Victorian to continue to do. Yes.
Well, the fact is that the Premier and the government have been acting on medical advice, and that's been, I think, a theme in Australia that hasn't been carried out around the world, and that has largely meant that we have come through things by world standards, at least in a pretty good position. The medical literature is strongly suggestive that the use of masks is very, very advisable because the cost, the inconvenience appears to be more than outweighed by the potential for benefit. And that benefit is to reduce the risk of getting the virus from someone else, and to reduce the dose of virus that we get, because we think that the more virus you obtain, the more likely you are to suffer a severe illness. And this is based on I think, the best available medical literature around the world. And that's where the public health authorities made that recommendation in Victoria, and that has been conveyed through the government to regulations that we have slowly gotten used to. And we think that the experience in Southeast Asia, where they learned about masks during the SARS epidemic, has help them get away with much lower levels of death and illness than, let's say, parts of Europe and parts of the United States and South America.
Disposable masks or cloth masks, ones you can rewash? What do you recommend?
I think in the community, either is appropriate, so long as they are used properly. You know, I find that having those reasonably well-made cloth masks are better in my family, because we can wash them after one use and reuse them, rather than go through lots and lots of these. When I'm in a hospital, I go through a lot of these disposable masks in the course of one shift. And, you know, that makes me feel bad. I hate waste. But it's not just the equipment in whatever circumstance, it's how we use it.
Correct.
And so it's things like when you put it on, try and put it on properly. Don't have it uncovering your nose or your mouth. Try not to touch the outside of the mask if you can. If you do, don't beat yourself up, but just then go and wash your hands with soap and water or the alcohol wipes. There's one thing I would say, George, and that is that, you know, there are some circumstances that are greater risk than others. If you're indoors with a lot of other people, you're at greater risk than you are if you are outdoors by yourself. But again, if the regulations are made so complex that people don't understand them or lose attention, then that's a problem. And so much of public health messages need to be that they are understandable, that people can keep up. I mean, you know, I'm a doctor and I've struggled to keep up with the rate of change that we have had to go through, certainly in Victoria, about what we can do and when.
And that's basically been because we knew so little about COVID in the early days. Dr. Stephen Parnis, thank you very much for taking us through the journey and helping us to understand, and also giving us some guidelines about how to live with COVID going forward. Thank you very much, and wish you stay safe, and we wish you a very good Christmas coming forward with the family.
Thank you very much, and to you as well, George.